I'm Nancy Brown. I'm here in Southern California with my doctor, Dr. Hirani. She's my post-Lyme treatment doctor that I found while I was in Arizona getting treatment for Lyme disease, which I was diagnosed with in November 2012. I was there for a 3-month program, and when I got back, I got treatment with Dr. Hirani. And she's helped me on many, many levels with many things, but one thing that really helped a lot was the hormones. So if you can talk to us about that, doctor, that'd be great, and how that might affect the immune system.
Definitely, Nancy. Your hormones are intimately linked to your immune system. So if you imagine them like a web-like connection, that's exactly what we're dealing with. So when your hormones are low, your immune system's going to be low. So when a patient comes to me with a history of an immune dysfunction or immune dysregulation, whether Lyme's or chronic mycoplasma infections or chronic strep infections, I want to look at their hormones. And for example, thyroid hormone is actually one of my mainstays in helping people with chronic fatigue. So I find that a lot of my chronic fatigue patients have low thyroid. Of course, I think outside of the box, and I don't just look at the lab results. My patients will come to me saying, well, my doctor told me that I don't have a thyroid condition. My thyroid function is normal, but yet I have all these symptoms of low thyroid. So I will look at things like basal, body temperature. I do a thyroid exam, and if I feel like thyroid exam is enlarged, and I'll send them for an ultrasound. Bottom line is, if I find that the basal temperature is low and they have overwhelming symptoms of low thyroid, I'm going to treat them. Of course, I'll monitor their levels in the blood, but I will treat them for their thyroid hormone. And one of the things that we did for you was you were already on some thyroid hormone, and it seemed to me like you still had symptoms of low thyroid. So we upped Nancy's thyroid hormone, and I do believe that you felt you had more energy from that.
Yeah, absolutely.
Another thing that we did was we looked at Nancy's growth hormone levels. And same thing again, there's a difference between a normal growth hormone level and an optimal growth hormone level. And Nancy's growth hormone levels were suboptimal. And she also had symptoms, overwhelming symptoms of low growth hormone. And these would include fatigue, of course, a tendency to social isolation,
sleeplessness,
sleep issues, and among many others. So we started Nancy on growth hormone injections, and you can tell us how they worked for you.
Sleeping like a baby. No, I'm sleeping a lot better. And yeah, I feel my energy levels way up. And the most important is the sleep, because I feel like I'm getting restorative sleep now, whereas I don't feel like I had that before. And so my stamina is much better.
Some of the other hormones that we looked at also in Nancy was her progesterone. And progesterone is a very important hormone, especially in menopause and postmenopausal women. If they're suffering from insomnia, if they're suffering from anxiety and moodiness and depression, this is definitely a hormone to be looked at. And again, you did come to me on some progesterone, and I felt that it was suboptimal or subtherapeutic. And we upped your progesterone hormone, and you can tell us how.
And again, I can only say that as you change the program with the hormones, the sleep got better and better. That was my measurement of it, is how I was sleeping, and more relaxed, much more relaxed.
And your mood, do you feel?
Yeah, yeah, very much so.
And then I think the last hormone that we looked at in you was your testosterone, and same thing again. So symptoms of low testosterone in a woman could be fatigue, depression, poor stamina, and decreased libido. Sometimes incontinence in women as well. Sometimes joint aches can also be related to low testosterone. So we adjusted your testosterone hormones, and tell us.
Well, I didn't have a lot of those symptoms, but again, the sleep has just improved. Yeah, and better stamina. I'm able to work out at the gym now, and I wasn't doing that before I saw Dr. Hirani. So that's huge for me to be able to do that.
Yeah, testosterone really
Yeah.
helps with physical endurance.
Yeah. All right, thank you, doctor.
You're welcome.